everyone, and welcome back to my channel. My name's Sophie, and this channel is about my journey to getting my life back after having been diagnosed with preload failure. In today's video, I wanted to talk about some medical updates, mostly from this past week, just because it's been a while and I did have some appointments and tests done this week. So first, I want to start with the dentist, which I mentioned in my last video. So, as I said a few weeks ago, I was having some fillings done. I had some cavities or tooth parts chipped off, what have you. So I ended up having 4 fillings done at the end of February. I went back this past week and I had an area of one of the teeth that had just been filled. An area next to it on the same tooth had completely chipped off. Yeah, the dentist said the tooth just wasn't strong enough. So that tooth will need a crown. It's not able to be filled. Then there's a second tooth that was fine 2 weeks ago when I was at the dentist and now has multiple areas that have chipped off, and that will need filling. But the catch is, because my mouth is so dry, he doesn't want to do any more work in my mouth until the dry mouth is taken care of. He said it wouldn't keep, that my teeth are just going to keep deteriorating until that's fixed. My saliva is apparently very thick. He can see that, and that he notices that I sort of chap my tongue when I talk, which I have noticed the little bit of video I watch before I post these, that I'm always doing something with my mouth, and I try to not do it when I'm talking, but I guess I don't do a good job not doing it. So I asked my primary doctor about something for dry mouth, and she didn't want to prescribe something extra because it works on the same pathway that Mestinon works on. So long story short, I emailed the doctor that prescribed the Mestinon, and since I am tolerating it well, he said to go ahead and increase the dose. So today, which is Saturday, I have increased the dose, and hopefully that will help with the dry mouth. I'm not sure how to tell. I guess I will go by when I wake up if my lip is sort of stuck to my teeth because my mouth is so dry. So hopefully, maybe in a week, less than a week, I'll have a better idea if that's helping, and I can go back to the dentist and start getting that dental work done. And hopefully, fingers crossed, if that solves the dry mouth issue, I will stop having all of these teeth issues, which I've never had before. Second, on the medical update, I did have pulmonary function tests done. They are still low. The pulmonologist that I saw yesterday on Friday was able to pull up previous pulmonary function tests I had done like 10 years ago, 12 years ago, in 2010. So part of my lung function has always been low. They don't know why. 10 years ago when they tried the inhaler, it actually got a little worse. So the inhaler doesn't help. So they don't know why. The part that is much lower is the DLCO, or what measures the gas transfer ability of the lungs, and they don't know why that's low. The pulmonologist said he doesn't really know what to do with me, that I might do well seeing someone who's more familiar with things that are more rare than what he's used to seeing. He also said, since at the same time I had my arterial blood glasses drawn, that since my oxygen is normal on room air, that I don't need to wear the oxygen. You will notice that I am currently wearing the oxygen. So when I got home yesterday, I did take the oxygen off and decided to get some objective measures of how I do when I'm not wearing the oxygen, because he said all of the improvements I noticed with my muscles not burning when I do activities, and the shortness of breath improving, the chest tightness improving, and all of that was probably just psychological. Even though I spent over a year and a half not wearing the oxygen, And when I started wearing the oxygen, a lot of my symptoms improved, and people were commenting on how much better I looked and sounded. He said that it was probably just psychological. So I wanted some objective data. So I've been wearing a EKG monitor when I sleep to get my resting heart rate, average heart rate, as well as my heart rate variability and all of that. So my average heart rate while sleeping last night was 80, and it had been prior to that in the upper 60s or low 70s. And I did wear it when I took a very short nap, very fitful, lots of tossing and turning. I thought my heart rate would be much higher, and when I checked, my average heart rate during that short nap was 68 when I had the oxygen on. Also, I wore it while walking down to the basement and back up to the second floor, and without the oxygen, my heart rate got up to about 160, versus with the oxygen, it went to like 145, and that was with a much quicker trip because I didn't have anything to do in the basement. I was going down solely to get the heart rate measurement. My oxygen also dropped with the 2 flights of stairs without the oxygen to the mid-80s versus staying at 97 and above with the oxygen. So yes, the oxygen does help, even though at rest my oxygen is fine, and at rest my oxygen is low normal according to the arterial blood gas, which he did say he would expected it to be higher given my age. So yes, it does objectively help my condition. I have said since almost the beginning, my elevated heart rate with normal activity was so my body would get the oxygen it needed, which is why I thought when I was on the beta blocker and my heart rate was lower, my oxygen was also lower. So that's my little rant on doctors and oxygen. I was also in the ER on Thursday. I was having chest pain at rest, and it was so sharp at times it was almost taking my breath away. They did an EKG, which had few abnormalities, which they said no significant change. Maybe it's not horrible, I wasn't having a heart attack or anything, but when this all started, my EKG was normal, and now it's not. So to me, that's a significant change. I guess they don't view it that way. They ran some blood work, my potassium was low, which is from the diuretic that I'm on, and I also started the ketogenic diet at the beginning of the month, as I've said, so I am losing more fluid than I had been previously, so I might need to adjust my potassium supplement. I'm emailing my primary doctor on Monday about that to see what she says. And they also did a D-dimer, which was also negative, so there weren't blood clots. And heart issues and blood clots were the 2 issues I was most concerned about. So since they were checked out, I came home late on Thursday night and went to my appointment early on Friday. So that is the medical update for the past week. Otherwise, yes, I'm wearing the oxygen again because obviously it helps. So I will be wearing that. I see my other pulmonologist who's familiar with preload failure on March 30th. So I will obviously be talking to him and getting his input on the oxygen situation and why it may be helping. But other than that, that's all that's been going on recently. Everything else is sort of the status quo, as I said in my last video about my symptom updates. Since doing the oxygen 24/7 and the Mestinon, I'm not sure what video I'll do on Wednesday. I need to check out my little list and see what I could get done. And next weekend, I will probably do a week update since I will be on an higher dose of the Mestinon to see if that's made any other difference. Hopefully improvement in the dry mouth. So that's going to be it for this video. I hope you guys are having a good day whenever it is you're seeing this, and I will talk to you next time.